Some therapies are better indicated than others for specific disorders.
If people have particular types of problems such as depression or social anxiety or panic disorder, eating disorders, substance abuse, for particular types of problems like that, we now know that there are certain therapies that have been shown to be effective with those particular types of problem. We call these therapies empirically validated therapies. For example, depression, which is quite common, has been found to be treated effectively by cognitive therapy, by a therapy called interpersonal therapy, and by another therapy, a behavior therapy that focuses on improving positive events in your life. With anxiety, there are many different types of therapy for different types of anxiety. So, for example, with social anxiety, there's research evidence that group cognitive therapy is very effective. With panic disorder, there's evidence that cognitive therapy is effective, relaxation therapy is effective.
Another form of therapy that is useful for many disorders is biomedical intervention.
Biological interventions are really important in the mental health field. Medication has just taken a huge role in many of the major mental illnesses.
The one thing that psychotherapists always keep in mind is that there is research that shows that medication can be helpful for depression, for many types of anxiety, but the medication in and of itself may not be a complete treatment package. For example, with depression, what the research shows is that while medication can help, even without psychotherapy, treat a single episode of depression, that if people are also in cognitive therapy, they're much less likely to get depressed again in the future. So it seems that psychotherapy has a role in terms of teaching people ways to understand their problems and what to do about their problems so they don't have problems again in the future. But medication can be very helpful in the short term to relieve some of the distress that can be caused by depression, anxiety, and other problems like that.
Linda found her therapy sessions to be helpful in dealing with her issues. But would these methods have the same effect on a person from another culture?
We can say that the answer is yes, because we all experience certain feelings. It doesn't matter who we are. We experience pain, we experience joy, we experience sadness. However, each culture has a different way of expressing those feelings. Each culture has its own way of believing that somebody understands them. And if we were to think about the nature of psychotherapy, in that one person is trying to understand another, we would realize that among cultures, between members within a culture, that there are different ways of really understanding another human being, another person.
There's no question that each individual can benefit from the therapeutic process, but the therapy has to be tailored to the culture, to the belief system of the individual. A lot of the benefit of therapy comes from the belief in the patient that this process is going to help me.